I'm Chris Harper, and with me is John, and we're here to demonstrate an application for shoulder stability. There are many instances where you may have forward or unstable shoulders causing discomfort. Some causes may include overuse, past shoulder injuries, ligament laxity, or flexor dominance. KT tape helps treat this condition by improving posture mechanically and comfortably. For this application, we're going to position the shoulder blades in a little bit of retraction or pulling them back. In other words, sticking the sternum or chest out. I'm also going to use these blue dots just to create some reference points. We're going to find the tip of the shoulder, the acromioclavicular joint or the AC joint. We're going to put a dot right there. We're also going to find the inferior bottom angle of the shoulder blade. Place a dot right there. And then drawing a line between the two, we're going to put a dot right next to the spine on the muscles back there. Okay, for our first piece, I'm going to take a full strip. I'm going to twist and tear the paper down near one end of the tape, and I'm being very careful not to touch the adhesive on the tape. I'm going to place this on this reference point that we made down low. You don't have to put blue dots on at home, but rather just these are reference points. I'm going to then stretch this piece to 25%. So I'm being very careful not to touch the adhesive. I'm just handling the paper. I'm going to stretch this 100% out, and I'll back off halfway and then halfway again. So I have 25% stretch as I lay that piece down. I'm going to give it a little bit of a rub just to create a little friction and some heat. I'm going to take my second full strip. I'm going to twist and tear the paper backing. I'm going to place this just on some skin above that first piece. So I'm going to find an anchor point, and I'm also going to angle the tape so it's heading towards this first reference point that we made. So I'm going to place this on some skin, being careful not to cross the spine. I'm going to lay that anchor down with absolutely zero stretch, just like I did with all the other ends of the tape. Now with this piece, I'm going to apply 50% stretch. So if I stretch out 100% and then back that off halfway, that is now at 50%. I'm going to lay that down, and now I'm going to remove the paper backing and lay that end down, just like I did with the other ends, with absolutely zero stretch. Okay, I'm going to give that whole application a good rub to create friction. That friction activates the adhesive so it sticks to the skin very well. Okay, that looks good. Some helpful tips before applying. Be sure to clean the skin very well. Remove any lotions or oils you may have on your skin. Take care with removing clothing, as this may roll the tape. This application can also be combined with other shoulder applications for maximal effect. Some complementary treatments may include rest, ice, sitting or standing with better posture. Please seek care if you have severe pain, swelling, or suspected dislocation or separation. For more information, see our website at kttape.com.